Hi, in this video, we're going to talk about the anatomical position. So, anatomical position is a position of the body where it is easier for a professional to localize part of the body. So, um, we can think of it as a part of the body. So, a way to position the body and to localize different organs. So, the anatomical position is when somebody is standing upright with their face, with their head and eyes facing forward, their arms hanging at their sides, their palm facing forward, with their thumb exterior to the body, or pointing away of the body, and their leg and feet slightly apart and pointing forward. So in the anatomical position, we can divide the body into different planes. We have the um, coronal plate. The coronal plate dividing the body into face and or front and back. We have the sagittal plane. The sagittal plane divide the body into left and right, and we have the transverse plane. The transverse plane divide the body into superior and inferior. So here you can see this is the coronal plate here, right here, and we see that it's like cutting the body into the middle of the head right here, into front and back. And the sagittal plane here, you see it goes to the middle and the cranium right here like this. So it is divide the body into left and right side, and we have the transverse plane which divide the body into superior and inferior. Superior toward the head and inferior toward the feet. And this is designed to pinpoint exactly what um, where organs are, where they are localized. So if I'm talking, and with this position comes certain term, like if I'm talking, like I said, superior, I'm talking about toward the head. And if I'm talking inferior, I'm talking about toward the feet. If I'm talking about, for example, proximal, I'm talking something that is close, and if I'm talking about distal, I'm talking about something that is far away. So close to what and far away to what. So here we can see that we can divide the body into a midline. So something that is proximal would be close to the midline, and something that is distal would be far from the midline. So for example, the shoulder here are more proximal than the wrist here, because it is closer to the middle. And we're talking about medial also. We talk about superficial and deep. So when we talk about superficial, we're talking about something that is more toward the skin, more toward the outside. And when we talk about deep, we're talking about towards the bone, so toward the inside. So I can say that my heart is more deep than my ribs, because my heart is more deep, more inside than my ribs. And like I can talk about my lung, or like I can say that my nose is more medial than my ears, those, or my so I can talk also about my wrist that is more distal than my shoulder, etc., etc. And here we can see for more precision, for them to be able to locate organs into our abdomen, they divide the abdomen into quadrant. So like this, we have 4 quadrant, and here like this. So here we see the left upper quadrant, And here we see the right upper quadrant. And you see the picture. So here we have the left um the left quadrant that is inferior here also, the right lower quadrant. So this is to localize organs. So there are organs that are on this side that I'm not going to encounter of this side. So if a patient come into the doctor's office and I say, ma'am, where are you hurt? Where is hurting you? And the person touches her left um I could say her left part here, the left side of her abdomen. I cannot I cannot assume as a doctor, I cannot assume that her appendix is hurting because her appendix is at the right lower quadrant. Or for example, if someone touches her right side, I cannot assume right left side, lower left side. I cannot assume that this person stomach is hurting. And for more precision, to be more precise, they can divide it also here, like you say, into 9 parts, 9 quadrant. So we can see here they call this the left hypochondriac region, the epigastric region, the right hypochondriac regions, and here you can see that here in the left hypochondriac region, we have also a tip of the liver. And we have the stomach and pancreas, we have the spleen, and large and small intestine, a part of it, a part of them. And here in the epigastric region, we have the more of the liver, that part. We have the stomach, we have this, we have the pancreatic glands, etc., etc. And the right hypochondriac regions, we saw that we have the here we have a part of the gallbladder here. We have a part of the colon, and the right lumbar regions. We have the ascendens colon here, as you can see. We have a part of the small intestines, and also we have slightly a little bit of the kidney, but it's not apparent because we are looking at the front view. And here in the left lumbar region, we have the colon descending, or the descending colon here. We have a part of the small intestines and also a part of the left kidney that is not shown here. And this is the umbilical region. Here we can see a big part of the transverse colon. We have a big part of the small intestine here. And in the right iliac regions, that's where we find the appendix, the cecum. We find the ascending colon, a big chunk of it. We have a small intestine, small part of the small intestine. And the hypogastric region, we have the bladder, the sigmoid, we have the colon sigmoid, we have the small intestine, a part of it, and we have the reproductive organs. So like I said, if a patient comes and complain from pain up here, I cannot assume that it's for example, if it's a woman, I cannot assume that her uterus is hurting, or that her bladder, she has a bladder infection, because she's showing me this part, which is the epigastric region. So the organ that I can assume that is hurting on that part, I can assume it's the stomach. I can assume it's a part, maybe a part of the gallbladder, or maybe the intestines. And here in the left iliac region, we can see the sigmoid colon, descending colon, and part of the small intestines. So that is what we're talking about, and why it is important to talk about the anatomical position. Because if I'm talking about the left hypochondriac region and the patient is laying on their side, then I cannot assume that if I cut her from a lateral side, that I'm going to find the liver. The patient has to be standing facing upward with their finger, their thumb facing outward, and their feet straight to assume where the part of the body is. Or if I'm talking about planes, then I can say, um, from a sagittal point of view, here is what is hurting, here is what is not hurting, or also from a transverse vision, etc., etc. So it is like a map, or of the body, some measurement, some way to pinpoint exact organ. So that was it for the video. Thank you for watching. Bye.